Most people know that a 401k plan is a valuable retirement tool. It's less well known that a health savings account also is a valuable retirement tool. An HSA is a tax advantage savings account that you can use to pay for your out-of-pocket medical expenses. Think of it this way. It's a long-term savings account to help you pay for your medical insurance costs during retirement. HSAs are paired with high deductible health plans, which have a lower monthly premium but a higher deductible. In fact, it's the only account out there with triple tax benefits. An HSA is different from an IRA or a 401k because it's not a tax-deferred account, it's a tax-free account. So your contributions from your paycheck are payroll deducted on a pre-tax basis. Your account also grows tax-free, and any interest, dividends, or capital gains are non-taxed. Lastly, your withdrawals are tax-free for qualified medical expenses. That's your medical, dental, vision, and your prescription expenses. So one thing you may not know is, according to this company called the Employee Benefit Research Institute, in 2019, the average American couple would need about $300,000 in savings, again that was last year in 2019, for a 90% chance of covering the out-of-pocket healthcare costs in retirement. That is pretty significant. So I think of it a way is to save for your retirement costs for medical expenses. The high deductible health plan is similar to a PPO plan with access to the same in and out of network physicians. Once you meet that annual deductible, and you do want to stay in network, everything else is paid at 100%. Your preventive care, like your mammograms, well woman services, routine colonoscopies, and prostate exams, are covered at 100%. Last year, the IRS added more items for individuals who may be diagnosed with hypertension or diabetes or congestive heart failure, asthma, and depression. So these items include insulin, a glucometer, A1C testing, blood pressure monitors, ACE inhibitors. These are all considered preventive care, and you don't pay a penny for them. It's all covered at 100%. So when you do stay in network, you pay the contracted rate that Florida Blue has with that provider. So you're not paying the $15 copay like you would be in the PPO plan, or you're not paying $5 for a prescription or a $250 copay for hospitalization at the PPO plan. It's actually the contracted rate. One good thing about Florida Blue's website is you can actually go on their website and find the cost of a prescription. So you're going to want to make sure that you do shop around and make sure that you are getting that lowest cost, because each pharmacy can charge you whatever they like for that prescription. The high deductible health plan is a good choice for healthy members that hardly use any insurance, or possibly opposite, the unhealthy individual who may meet their deductible in the beginning of the year, and then after that they have no other expenses. So you do have a $4,000 deductible for family coverage in network. So let's look how you can cover most of those expenses. Premiums between the high deductible and the PPO plan. You can see in the high deductible for family coverage you have a $60 per month premium. In the PPO plan you have $220, so that's a $160 monthly difference. On an annual basis, that's $1,920 that you would be paying just to have that PPO plan. I suggest that you take that money and you put it into your account, your health savings account, to help you meet that annual deductible. And if you remember, that deductible was $4,000, so you're now halfway there and you haven't spent a penny. And you're also paying for your health care costs with pre-tax dollars, as that money wasn't taxed when it comes out of your paycheck. If you participate in the PPO plan or the HMO plan, when you go to the hospital, the doctor, or have any medical expense, you're paying for that with after-tax dollars. Your paycheck has been taxed. So what I want to do is show you how you can get really close to that deductible and really not spend a penny. I'm going to be looking at the family coverage column. So as you remember, your premium savings that I just showed you on the last slide was $1,920 by going into the high deductible plan versus the PPO plan. So your deductible for the family coverage is $4,000. You just saved $1,920. I don't know if you are aware, but the city contributes money into your health savings account. So they give you money. For family coverage, they give you $115.33 each month. So on an annual basis, that's $1,383 and change. So if you add the $1,920 in the premium savings and the money that the city gives you, and you subtract that from your deductible, your remaining amount that you could possibly have to pay is just under $700. So you do have that deductible, but don't forget that we have an employee health center where you receive medical care and prescriptions that they have at no cost. Plus, if you don't have any expenses, you just put $3,300 into your health savings account and you haven't spent a penny. To take full advantage of tax savings and to build a reserve for the future, it's suggested that you maximize your contributions. Each year, the IRS will set the annual maximum contribution amount, and for family coverage in 2021, the maximum that can be contributed to your health savings account is $7,200. For family coverage, as I just mentioned, the city gives you money to the tune of $1,383 and change. So if you can contribute the difference if you'd like to come up to that $7,200. I definitely suggest that you contribute the premium savings of that $160 per month into your account so that you're only $700 away from the out-of-pocket maximum. Qualified medical expenses, it's just not your medical bills that you can use your HSA for. You can use it for dental, vision, hearing, and chiropractic services. Here are some of the advantages of a health savings account. Unlike a flex spending plan, this is not a use it or lose it plan. This is a use it or keep it plan as your unused funds roll over each year. You have convenient access to your money with a debit card and online access to uploading your receipts. At age 65, you can use the money in your health savings account for any expense without paying a penalty. It can be used to pay for your Medicare Part B, Part D, and your Medicare Advantage premiums. You can pay for long-term care insurance with your health savings account funds. You can switch plans during open enrollment if you don't like the health savings account or if you know that you will have surgery or are having a baby in the upcoming year. Retirement is also considered a qualifying event, and you can switch from the high deductible health plan to a PPO plan or an HMO plan where you have set co-pays and you don't have to meet the higher deductible. Another advantage of the health savings account, and it's unlike the flexible spending account, you own your health savings account permanently. With a health savings account, you have convenient access to your money. And when you set up an online account, just like a bank, you have a variety of options to choose from. About some of the advantages of a high deductible health plan that includes your health savings account. Now let's just go over a few of the disadvantages. So it may be difficult to come up with money to meet the deductible if you experience health expenses within the first few months of the plan. Also, illnesses are unpredictable and they may be hard to budget for your healthcare expenses. The other thing that you need to know is you need to upload your receipts to the health equity account, and they don't need to be sent to the IRS unless you are audited. I know this is a newer plan and a different way to think about your insurance. So think about if you're a homeowner or if you have car insurance, you have a deductible, right? So what you have to do is you have to meet that deductible. If you want to have a lower premium for that plan, what you would need to do is you need to raise your deductible. It's the same philosophy with a high deductible health plan. You have a higher deductible, but your premium is much lower, and you can set aside money to pay for those expenses in retirement, which is very important. So if you have any questions about this plan, please reach out to me, Lauren Ferreira, here in the HR department, and my number is 799-4117.